We are here at RMH's Cardiac Rehabilitation Center, here with cardiologist Dr. Brad Rash. Doctor, this room was full of a bevy of activity a few minutes ago. What happens in this room?
This is RMH's Cardiac Rehabilitation Facility, and we have treadmills, machines, and a walking track, and the ability to perform cardiac monitoring for patients who are going through a really tough transitional period. More importantly, we also have a really great team of nurses that provide education for those patients.
So what would have happened for a patient to be referred to this program?
Usually these are folks that have had a recent heart attack. Perhaps they've had recent bypass surgery or other heart surgeries. They could also be for folks that have had a recent stent and perhaps have some stable symptoms of chest pain.
Dr. Rash, I just learned through the American Heart Association that more than 1/3 of women, adult women, have some form of cardiovascular disease. That was really surprising to me.
Yes, it's a very important point. Cardiac disease kills more women in this country than the next 3 causes combined, and that includes all forms of cancers. So it really is an important issue for individuals, families, and it's a public health issue as well.
So what are the symptoms that women really need to pay attention to?
Well, women, like men, the majority of them have the common symptoms of chest pressure radiating perhaps to the left arm. But women, unlike men, very often will get more vague symptoms, such as just shortness of breath, feelings of anxiety or discomfort that they may not quite be able to put their finger on.
Dr. Rash, do you have specialized training in women's heart care?
I attended Medical College of Virginia for medical school and continued on with the residency in internal medicine. So I'm board certified in internal medicine as well as cardiovascular diseases. I developed a special interest in women's heart care about a year ago and sought out one of the world's experts at Cedars-Sinai in Los Angeles and was able to spend a few weeks with her this past summer and learned a lot about it then.
What really stands out in that training?
Well, women have a specific type of heart disease that men very often don't get, and it's termed microvascular angina. It really involves the tiny vessels of the heart, and women can often present with chest pain and go for a heart catheterization, but have normal appearing coronary arteries, which are the large arteries that supply the heart. These women may in fact be having microvascular angina, which is very often treated the same way. But they do have a higher risk in the long term, and so we should pay special attention to these women.
And is that diagnosed with a heart cath?
Well, there is a specific way to diagnose it in the cath lab, and that's through something called coronary reactivity testing. It's an old technology that's now being used for something that we are just now learning about.
When a woman has a heart attack, are the outcomes better or worse for women than men?
Outcomes for women are actually worse.
Wow.
A woman is more likely to die within a year of having a heart attack than a man is. And more women develop heart failure within the next 6 years of having a heart attack than men do. Other problems are that women are less likely to undergo diagnostic testing and invasive testing than men are.
So is it primarily an educational issue, or are our bodies just that different?
Well, we really want to attack it on 2 fronts. One is with education and awareness, so that patients, doctors, primary care doctors, and OBGYNs know that this is, and understand that this is not just a man's disease. But also we want to focus on prevention. And really trying to modify those risk factors that we know increase heart disease in women.
So Dr. Rash, what is your advice for women in taking care of themselves with regard to their heart?
Well, most importantly is modifying those risk factors. So quitting smoking is very important. Diet and exercise are often talked about and always underestimated. We recommend the Mediterranean diet. In addition to at least 150 minutes per week of at least brisk walking. Blood pressure should remain under control and at goal, and cholesterol levels should also be modified.
Well, I can actually say, being a student of your Heart Check program, I was able to get on the program and lower my blood pressure with all of those things you just recommended.
Great.
Where can women go to learn more about risk factors and cardiovascular disease?
Well, the American Heart Association has a website called AmericanHeart.org. Women could also go to womensheart.org. which has a lot of information about heart disease in women and how to modify risk factors.
The next thing I know, it was like that proverbial elephant tap dancing on your chest, pains radiating down my arms, very intense pain in my chest. When the local rescue squad arrived during the midst of my cardiac event, one of the questions they asked me were, where do you want to be transported to? Having served as a volunteer chaplain at Rockingham Memorial for several years and having seen firsthand the excellence of that program, I told them, please, I would rather go to Rockingham Memorial. I have full confidence in the staff there. And Dr. McLaughlin was able to implant a stent to open that artery up and to get the blood flowing again. I was given a new lease on life through what was done in the cardiac cath room at Rockingham Memorial. In essence, had a new heart. I feel better now than I have in 20 years. The care I received at RMH was as if my own family were caring for me.